912. We're going to get to this now. For the past few months, many have maybe avoided going to the doctor for regular screenings out of concerns over coronavirus. Screenings for mammograms are among those. Mammograms are down 80% right now. So joining us now to talk about this is Dr. Tara Spivey. She's from Ascension St. Vincent. And Dr. Spivey, thanks for joining us this morning. We know a lot of people are putting off appointments because of COVID. And I know you're seeing this as well. What are patients telling you? Are they just scared to be near a hospital, any hospital environment right now, some of them?
Yeah, they are. And it's important that we're talking about this morning because, coronavirus, we're now several months in, and as a hospital system, we know how to protect our patients better than ever, and extra precautions are being taken universally. And it's important not to neglect the care that patients need because this could lead to some very significant downstream problems. So we want our women to get their mammogram scheduled, get back in if they got postponed, because we know that early detection is key to the best outcomes and trying to make sure that a woman doesn't bring an early lesion that needs attention.
And, talking about mammograms specifically, how dangerous is it to put off a mammogram? Why is this something you shouldn't wait on?
Absolutely, you shouldn't wait. This, primary prevention with screening mammograms works very well. We know that when women get malignancies caught early, that they have the best chance of cure across all subtypes of breast cancer. And it's not that you should be afraid of getting your mammogram. We know that when it's confined locally and we catch things, that we're going to have both more surgical options and the best outcomes possible. And unfortunately, 1 in 8 women, this is the statistic that gets the most publicized, but it's true, 1 in 8 women will have a breast cancer in her lifetime. So it's important that we keep up with this. It's not something that should ever be neglected.
Yeah, and I think so many people can say someone I know. If it's not yourself, there's someone you know who's been affected. Can you talk generally about the safety steps your office is taking extra now to protect patients so they do feel comfortable when they go in? Some things that they may notice that are a little bit different?
Absolutely. So everybody is aware of universal masking, and all of the staff and physicians give more space than ever to allow distancing while still delivering excellent care, but just being cognizant of keeping a distance and also, so especially when you're talking to a patient, and thorough detailed cleaning more than ever. Even though we do practice that regularly, it's been taken up a lot of notches to make sure to ensure the safety of our patients. And we limit the number of visitors and traffic through our waiting rooms and in our clinics and in the hospital as well.
And just talking a little more generally about mammograms now, what are some risk factors that people should know about that mean, hey, you do need to go get a mammogram right now? It's maybe not something anybody wants to think about, but let's talk about those risk factors really quickly before we let you go.
Certainly. So everyone should get every woman should stay up to date getting their mammograms, but certainly women with significant family history, women that may even have indications to get genetic testing from that, women who have had previous high-risk lesions and dense breast tissue are at higher risk, just to name a few.
All right, Dr. Spivey, thank you so much for talking to us this morning. It's such an important topic. We really appreciate it.
Thank you for having me.
All right.